Thanks, Tim. Let me move forward. I'm going to take a few minutes here, and I'm going to talk about CallPointe's automated appointment reminder service and also some of the other messaging services that CallPointe offers. To give you a little summary, CallPointe's been in business now for over 12 years, and we've really stayed focused in this area of patient communication. Company's headquartered in Tucson, Arizona, and from the very beginning, our mission was to create an easy-to-use, web-based communication tool for medical professionals. And I think you'll see here we've stayed on a lot of the leading edge of technology to do this. A couple of things. CallPointe designed this service to work with all of the McKesson softwares. One of the things we've done is we've streamlined everything so your office staff is not required to do anything on a daily basis to make this happen. So what we do is we set up a daily extract from your whatever software you're using. That information that we extract out of the database is typically the patient's name, their telephone number, date and time of the appointment, the provider they're seeing, an appointment type. If there's multiple locations, we'll pull that location code as well. All of that information is then put into a file. That file is encrypted to meet the HIPAA guidelines, and then we send that via the internet to our call center. Now, that whole process on a daily basis is automated, so again, no interaction with staff is required. Once the data is received at our call center, the information is filtered, and then the messages are put into the appropriate queue to deliver the message. In today's marketplace, you know, some people want email, some people want to get a reminder via text, and some want to get a reminder via telephone. We have the capability to deliver any combination of those that your patients might like to receive the message. So a little bit about our calling network. CallPointe is on the leading edge of technology. We have an all-digital calling network. One of the things that really helps us out is distinguish between a person and an answering machine when the phone is answered. And so we can have different messages if it's an answering machine versus a person. We also make about 15 attempts to reach no answers and busy signals throughout the day. We call about every 45 minutes to try to reach a person. We can detect and report back to you numbers that are disconnected or no longer in use. One of the things we do for quality purposes is we record all of the calls that we make. A lot of times we have patients who will say, you know, they received the wrong date and time or the wrong location. We can actually go back and play for the office that call so you feel very comfortable that the message was delivered correctly. And one thing that's important is we can put out a different caller ID for each location that you have. So for all practical purposes, the patient will believe that the call is coming right from your office. So they're more likely to pick that call up and answer that call. Okay, a little bit about email. We're based on a template type of email service, so you have the ability to select a graphic that would go at the top. The message script is what you're using either for calls or for emails. It gives the patient the information you're looking for. We can put your name and location. You can have the optional confirm button, which sends information back to the practice. You can have a optional cancel and reschedule button if that's part of your strategy for communicating with the patient. And then you can have other optional information like a Google map that they can click on to show directions and location. And then there's also a button they can press to add it to their Outlook calendar. So these are all available in your email options. As far as text messaging goes, text messaging has a 160-character max per text message, so you can go longer than that on a text message. It would just go out to the patient in 2 different text messages. But this is just a sample of what you can actually communicate in a 160-character type of text message. With CallPointe, when you're looking at the different messaging options, you don't have to select from a cookie-cutter list. You have flexibility in the messaging, whether it's telephone, email, or text. And that flexibility, if you have different providers want different messages, they can have that. Different locations can have different messages. Different appointment types. So if you have a certain appointment type, say, for example, a physical, and you want to tell the patient to fast 12 hours prior to their appointment and follow all instructions. If it's a cardiology appointment and they're having a stress test, you could ask the patient to make sure they wear comfortable clothing. We also have Spanish language available, and we can actually do multiple types of languages for your practice. Again, whether it's telephone, email, or text, you have the capability to ask to press 1 to confirm the appointment or to cancel and reschedule the appointment. We do all human recorded voices, so you have 2 male and 2 female voices to choose from that we studio record those messages for you. And of course you have patient feedback and prompts such as survey questions or confirm, cancel. Reporting we have available. You'll always have online access to your call reports. We also have daily email reports that can go out to people within your practice. We also have optional bidirectional where we can actually feed some of that information right back into your software. A couple different messaging types. As you're all aware, with meaningful use, recalling patients that have needs. You know, someone who needs to come in for their annual appointment may not have it scheduled. We can pull that information and make those calls for you. As physician schedule changes, we can call to let people know that their appointment has changed or need to cancel. No-show calls, patient surveys, inclement weather. If you need to securely communicate with your patient, we have that available for you as well. And collection calls are all different options you have available. A little bit about how we price this service. We have volume discounts based upon your monthly volume. You're billed once a month, and CallPointe only bills you for completed calls. So calls that are never answered or bad telephone numbers, you don't pay for those. There's a one-time setup fee for creating that integration into the practice management software, studio recording your messages. That is a one-time fee. There's no long-term contracts. You're not locked into a year or a multi-year contract. You simply have a 90-day written notice to terminate the service. There's no annual support or maintenance fees associated with our service. And we provide a 30-day risk-free trial. And that risk-free trial will set up everything. We'll make your calls for you for 30 days. If you don't like it, you can cancel. You don't have to pay anything. When you do continue after the 30 days, we will charge you for the setup and for those first 30 days. That is really a very quick summary of CallPointe service. We'll be able to answer any questions at the end, or you'll see my contact information here. You can feel free to give me a call or an email. I'll be happy to answer any questions for you like that.